Today on Daily Cafe, it's a nuisance for a lot of women. Spider veins, how to get rid of them. Plus, stopping your dog's bad behavior and numerologist Lloyd Strayhorn's future forecast. Daily Cafe starts right now.
Live from the nation's capital, this is Daily Cafe.
Ooh, I like that. Perk up. Welcome to Daily Cafe on this first day of November. I'm Felicia Taylor.
Is it the first day?
Yes.
Gracious. I'm Sandra Pinckney Pop.
More than half of all women in the U.S. are dealing with some of these bulging veins.
Oh.
It's just so distressing. From varicose to spider veins, women try creams, potions, lasers, surgery, anything to make them go away.
But what really causes these unsightly marks? Here to tell us what causes spider veins and how to prevent them, more importantly, is Dr. James Laredo. He's a vascular surgeon at Georgetown University Hospital.
Doctor, first of all, oh, by the way, if you have questions about spider veins, of course, you can call us at 1-800-528-2090. Who is most susceptible to getting varicose veins? I mean, I read in the research that it happens during puberty, when you're pregnant, when you have menopause, and if you use birth control. So, frankly, anybody's going to get them.
Well,
your whole life.
The risk factors or the contributing factors for developing varicose veins, there are basically 5. The biggest one of which is hereditary. There's a big hereditary component to varicose veins. So I tell my patients, if they have a family history, it's not their fault that they have it. They have varicose veins. In addition, female gender, more women than men have varicose veins.
Is that because we wear high heels?
It's primarily because of the estrogen.
Okay.
Estrogen levels, in women, estrogen levels are higher than they are in men. In addition, pregnancy, there's a hormone surge that also contributes to the development of varicose veins. In addition, prolonged standing, so professions where people are standing on their feet long term, they are at increased risk of developing varicose veins.
Okay, I'm sitting down
also,
forever.
Obesity. Obesity also contributes to development of varicose veins, and also
oh gosh.
Before you go any for obesity and
age.
And age. Okay, so what's the difference between a spider vein and a varicose vein, or is there a difference?
Yes, actually there is a difference, and all of these veins fall under the category of varicose veins.
Okay.
The varicose veins, as you know, you've probably seen people with them. They're these big, ropey-looking veins. Those are the big bulging veins. Those are varicose veins. The spider veins are smaller. They're much smaller, and they're just underneath the skin.
This is more like a spider vein.
Just like that, like what's on the picture there. That's a picture of that's a spider vein. It's a very, very small. Usually, spider veins don't cause symptoms, whereas varicose veins, because they're so big, they can cause symptoms. They hurt. Yes, they do.
They look like they hurt.
So, at what point do you need to see a doctor if you have varicose veins or spider veins?
When you start at one point, if you notice that you're developing more veins in your legs, if you start developing symptoms, the most common symptoms that patients complain of are pain around the varicose veins, swelling in the legs, heaviness, a feeling of heaviness in the legs, itching also around the veins. Yes.
Really?
Some patients have a lot of itching, and also cramping at night. But patients with big
cramping of the legs?
Cramping,
that happens to me sometimes. Oh gosh,
so
I hope that's not a precursor.
So big varicose veins are also at increased risk of forming clots within the superficial veins, and patients can develop phlebitis as well.
Phlebitis, exactly.
So if you notice anything out of the ordinary, any pain around the varicose veins, development of new varicose veins or development of symptoms, that would be the time to go and see your physician.
How can you actually treat this? I mean, I know there are a number of ways out there. How do you choose which is the right one for you? Let's start with something called sclerotherapy.
Okay, sclerotherapy. Well, talking about treatment and who needs treatment, well, about 60 to 70% of women with varicose veins that give them symptoms have a second condition known as venous insufficiency. So these are 2 separate vein conditions that often occur together. So if you see a patient, as a physician, when we see a patient with varicose veins, we want to make sure that the patient doesn't have the second condition. And this is easily diagnosed with an ultrasound. Okay. And if they have underlying venous insufficiency, that should be treated first, because that should be treated at the same time. Because if you only treat the varicose veins and do not treat the underlying venous insufficiency, you have a high likelihood of having those come back. Right. And there are some of these cosmetic vein centers that only treat the varicose veins and do not treat the underlying venous insufficiency. And that's why those patients come back. Right. And we see a lot of those patients who go to these cosmetic vein centers that only treat the veins.
And sometimes it's more serious than just that.
Yes, that's
Jennifer
correct.
from Virginia is on the line right now. Jennifer, you have a question for our doctor?
Yes, I'm wondering what kind of treatment options do I have for my spider veins? I've had them for years.
Excellent.
Well, treatment of spider veins, there are mainly two types of treatments. Number one is laser therapy, cutaneous laser therapy performed either by a plastic surgeon or a dermatologist. Unfortunately, lasers don't work very well for spider veins. They're painful. They require several treatments. The second option is sclerotherapy, which is the mainstay of treatment for spider veins. On that one picture where we had a before and after picture of a patient with spider veins, that patient underwent sclerotherapy treatment.
And what is that?
Can I ask you something about laser, though? Because I have them in that small little place on your foot or your ankle. And I went to my dermatologist to see if I could do anything about it. And he said, no, that not even laser was an option for me, that it's too sensitive in an area and you can't do it.
Well, some parts of the body, particularly the ankles, some clinicians or sclerotherapists don't like to inject in that area because it's painful.
I bet it is.
He refused to do it.
Yeah. So, but you can safely treat varicose veins and all over the place.
Really?
All over the body.
All right, Debbie from Pennsylvania, you're on the phone. You have a question for our doctor.
Yes, I was wondering if you could get varicose or spider veins by crossing your legs a lot.
Well,
dispel this myth, please.
Well, any kind of pressure on the vein, any kind of pressure on the legs can actually can increase your likelihood of developing these.
So you really shouldn't cross your legs.
You really shouldn't, but is it critical that you do not? No, it's not. I mean, but we do see patients who do develop spider veins after minor trauma to the area. For example, I saw one patient who had a paintball injury to the leg, and several months later she developed spider veins around them.
Before you go, they're wrapping us, but you've got to at least give us some information about what we can do to prevent them. I know one of them is not to cross your legs so much. Support hose, a good idea?
Yes, absolutely. Not just support hose that you buy from the store, but graduated compression stockings.
Yes.
This is where the compression is highest at the ankle, and it decreases as you go up the leg.
And where do you get those?
You can buy those at any pharmacy.
Okay.
Any pharmacy.
They're not pretty, but they'll help you. They work. And elevate your legs as much as possible?
Absolutely. And trying to stay off your legs as much as possible as well.
I like that.
Just lounge.
Just pamper me.
And the compression stockings are also important to prevent developing deep vein clots in the legs, particularly when you're standing on your feet all day, when you're flying in an airplane and riding in a car.
That's a great time to wear them. I got to go get a pair. All right.
We got to get a pair. Thank you so much.
You're welcome.
Thanks,
Appreciate
Doctor.
your time.
Using